symptoms that allows clinicians to diagnose lupus and sometimes patients to be aware that they have something wrong includes fever, inflammation of the joints, including the hands, rash on her face, the very famous butterfly rash that comes up when patients are exposed to the sun, hair loss, but it's not the hair loss that most women or men have when they take a shower. It's usually the hair loss that you see in your pillow in the morning, oral ulcers, and sometimes you end up in emergency because you have a clot in your brain at young age, or in the lung, or in the legs. Sometimes it manifests as inflammation of the kidney that doesn't hurt, but it's picked up by a lab test and will show blood in the urine, proteins in the urine, and sometimes inflammation of the lung, and you may start bleeding. So lupus usually involves any organ, and the initial manifestation could be very mild and sometimes very severe. So this is the difficulty that we have as clinicians, because the spectrum is so wide that sometimes it doesn't appear at the first time. And the reason why we wanted to make it more available, tools more available to think about lupus first as a possibility when something is going on, is to allow individuals and clinicians to make the diagnosis. Contrary to what happened in other diseases, I will insist that this is a disease of young women in general, between 25 and 35, and some individuals, and this is one main problem, do not want to be seen as patients with a rheumatic disease because they think that arthritis is a problem of elderly individuals, and a lot of people delay seeking care, and this is one of the reasons why sometimes we get the diagnosis late. And GPs need to be more aware of thinking that unexplained symptoms such as fatigue and fever and arthritis in a young woman could be due to lupus, and that will facilitate the diagnosis. There are some specific tests that are useful to diagnose the disease, but we have to be very careful because those tests sometimes do not mean that the patient has lupus. One of these tests are called ANA, which stands for anti-nuclear antibodies. This is a marker for lupus. Pretty much 95% of individuals with lupus will have this autoantibody. However, not everybody with this autoantibody will have lupus. And this is something to be keeping in mind, because people may get paranoid or worry that they were positive for this autoantibody, and they may think they have lupus. Therefore, it's important to keep this in mind. There are other autoantibodies that facilitate the diagnosis, and those are usually asked by the specialist. So if we want to make the diagnosis, we have to think first on the disease, and then run the lab test, and then refer to our rheumatologist.